So welcome everybody to the meeting of February the 28th. And I'm just going to run through a couple of rules as we normally do with Zoom meetings. First of all, anyone participating on Zoom, please keep your microphones on mute unless called upon to speak. Those participating by phone, please keep the phone on mute at all times unless called upon to speak, and do not put the phone on hold. Finally, please avoid using the speakerphone when speaking. Please speak directly into your device's microphone or your telephone receiver. I'm now going to ask Deanne, the board secretary, if you please conduct the roll call.
Thank you, Chair. Member Banham?
Present.
Member Cloutier?
Present.
Member El-Shantari?
Present.
Member Gower?
Here.
Member Kavanaugh?
Here.
Member Lakin?
Here.
Member Menard?
Here.
Member Pinel?
Present.
Member Tilley?
Here.
Vice Chair Di Giovanni?
Present.
And Chair Aguilar.
Here.
You have quorum, Mr. Chair.
Thank you. I keep on unmuting and keeps on going back to mute. I don't know, maybe the mute button is broken after all this time on my laptop. So procedures for Zoom meeting, again, the following procedural guidelines are being implemented to promote orderly proceedings of this virtual meeting. Attendance, should members need to leave the meeting for whatever reason, they should advise verbally that they're doing so before clicking on leave meeting from the Zoom platform or ending their call of participating by phone. In terms of speaking order and the process for speaking, I will provide each member with the opportunity to ask questions or comment. Members will be called upon to speak in the order or reverse order as set out in the board secretary's voting list. The usual 5-minute limit will apply. Should you not wish to speak on a given matter, you may decline verbally when your name is called. In terms of voting, if a full recorded vote is not taken for a given item, I will specifically ask if the item is carried and then call for dissents to ensure that all votes are properly registered. Points of order, privilege, or challenge. Procedural interjection should be kept to a minimum to ensure the meeting proceeds smoothly and to minimize confusion. For points of order where you have not been called upon to speak, please state your name aloud for the record before stating your point of order. Should we require a recess for technical difficulties or other unforeseen matters during the course of the meeting, unless the board secretary issues new instructions, members are requested to remain on the line. The board secretary will mute all participants in such an instance. I don't believe we have any declarations of interest. And so I'll ask for confirmation of the minutes of our meeting of November the 29th, 2021. Carried. And confirmation of the minutes of January the 24th, 2022. Carried.
Carried.
Thank you very much. The board will receive communications as noted in the agenda. Received?
Received.
Thank you.
Received.
I'll now call on Member Cloutier to please move the motion to introduce reports.
Thank you, Chair. Il est résolu que le rapport verbal du président du conseil de santé, le rapport verbal de la médecin-chef en santé publique et les rapports intitulés Délégation de pouvoir, contrat accordé pour la période du 1er janvier au 30 juin 2021 et participation à la rencontre de la section des conseils de santé de l'Association of Local Public Health Agencies, ALPHA, soient reçus et examinés.
Carried?
Carried.
Carried.
Thank you. We'll now go through the consent agenda. For those participating from home, who may not be familiar with this process, I will list each item on the agenda, and for any items where board members don't have any questions or concerns, and we don't have public delegations registered to speak, the board may carry or receive those items on consent, which is to say, without any discussion. So first of all is my verbal report. So we'll hold that. Secondly, on the agenda is Dr. Etch's verbal report, and we will also hold that. We also have a public delegation on Dr. Etch's report as well. Third item is delegation of authority contracts awarded for the period of January 1st to June 30th, 2021. Can we receive this report for information? Received? Thank you. Number 4 is a little bit of an odd one, but because we rescheduled the February 14th meeting, this was to be voted on then, and that was to confirm attendance at the Association of Local Public Health Agencies, Alpha's Board of Health Public Health Section meeting. And that was, we were to approve that the Board of Health for the City of Ottawa Health Unit approved the participation of myself, Vice Chair, and Member Gower at the Association of the Local Public Health Agencies Winter Symposium and Board of Health Section meeting to be held virtually on Friday, February 25th, 2022. I can tell you we did attend, and Deanne made all the arrangements for that. She suggested we could go ahead and do that, but we should still vote on this retroactively to confirm that, in fact, we were allowed and did attend. So is that acceptable to everyone?
Very.
Thank you. And then we will go back to item number 1 that we held, which was my report, and then it'll be followed by Dr. Etch's report. So welcome to the board meeting once again on February 28th. I want to take this opportunity to thank all the board members for their willingness to reschedule the February 14th meeting due to the protests and state of emergency in the city. It allowed everyone a little breathing room and left the focus on addressing the impacts of the occupation of our downtown. So I want to thank you all for your flexibility and your understanding that some members of the board were engaged actively on that file. Many city staff were engaged actively on that file, and just as I say, was of assistance in dealing with that situation in our city. So thank you for that. It seems these days we are inundated with one emergency or crisis after another. Pandemics, protests, and of course, right now we have the war on Ukraine. I would ask if you could join me in a moment of reflection in solidarity with the brave Ukrainian citizens fighting against the current threat in their country, against both their way of life and their well-being. So if we could just take a moment, perhaps to have consider them and send them our thoughts. Thank you for that. As stated earlier, our meeting was to be held on the 14th. And at that time, one of the things that I wanted to speak to, was that February was Black History Month. Of course, we're now on the last day of February, but I still believe it's important to highlight and talk about that special month in any event. February, as I said, is Black History Month, and where each day serves as a reminder to reflect upon and honor the legacy of Black Canadians who have played a tremendous part in shaping our shared history, and to uplift the ongoing contributions of Black Canadians whose efforts and identities continue to enrich our communities. This is also an opportunity to reinforce our commitment at public health to confronting anti-Black racism in our community and in our workplaces by fostering a culture of inclusion and removing barriers for Black employees through workplace policies and hiring and retention practices. Nationally, this year's theme for Black History Month is February and Forever, celebrating Black history today and every day, which challenges us to take our commitment to celebrating Black history and Black Canadians beyond February and show our everyday efforts throughout the year. The theme really resonates, particularly given recent events in our city. that resulted in some people from racialized communities being subjected to hate speech and harassment. It is unfortunate that those events marred what should have been a time of celebration and recognition for members of Ottawa's Black community. Notwithstanding the unlawful demonstrations and occupations in downtown Ottawa, I do hope that everyone did have the opportunity at some point over this past month to find some meaningful way to engage with Black history and culture in our city. And I can say earlier today, I had the opportunity to stop in at the Centerpoint Library. And I want to thank the library. There was quite an extensive display there, a variety of pieces of literature, books, both factual and fiction, on display, and for people to access and to get a better sense and understanding of the contributions of the Black community to Canada. I'd like to move now to talk about another most unfortunate event, and that is last month we learned of the discovery of more unmarked graves, this time on the grounds of a former residential school in Williams Lake First Nation. This is yet another reminder of our tragic shared history. I encourage everyone to take the time to acknowledge and honor all of the Indigenous children who never made it home, their families, and their communities. It's important that we continue to recognize the impacts of colonization and actively keep working to raise awareness of the residential school system and its multi-generational impacts, which continue to be felt. We must also continue to commit ourselves to a reconciliation journey. I also want to report on a meeting that was held with Minister Thibodeau, working as a member of the Association of Municipalities of Ontario's Health Task Force. Last month, I was able to arrange for a meeting between myself, Dr. Etches, and Minister Thibodeau, Ontario's Associate Minister of Health and Addictions. We met on January 31st to discuss mental health and substance use health concerns in our community and how OPH could share its experiences around programs like Safer Supply and partner with the province going forward on projects such as meaningful data collection. This work aligns with the mental health and substance use health report considered by this board last September and the recommendations we approved at that time. OPH will continue to pursue these aims with the province. As many of you know, on January the 26th, as part of his State of the City address, Mayor Watson announced that this year, in recognition of her outstanding efforts and leadership, he will be giving the key to the city to Dr. Vera Etches, our medical officer of health, who's been an incredible leader to an incredible team since the start of COVID-19. In making this announcement, Mayor Watson noted that Dr. Etches has inspired control, confidence, and calm to our residents in the darkest days of the pandemic. And as a result of her efforts, Ottawa has been a leader in the fight against COVID-19. Moreover, and I think completely appropriately, because Dr. Etches could not have delivered such a professional and coordinated response without the help of others, Mayor Watson indicated we'd also be giving the key to the city to the entire team at Ottawa Public Health, who have been instrumental in these efforts all along. For those of you listening at home who may not be familiar with this award, the key to the city is the highest and most prestigious honor bestowed upon distinguished persons and honored guests of the city of Ottawa. I'd like to take this opportunity to congratulate Dr. Etches and the entire OPH team for this well-deserved recognition. This past Friday, Vice Chair Di Giovanni, Member Gower, and I participated in the virtual Alpha Winter Symposium and the Board of Health section meeting. The morning included remarks by the Honourable Christine Elliott, Ontario Minister of Health, and James McGarvey, President of the Association of Municipalities of Ontario. An update from Dr. Kieran Moore, Ontario's Chief Medical Officer of Health. We also heard presentations by Dr. Teresa Tam, Chief Public Health Officer for Canada, by several representatives from Public Health Ontario, by Ontario Health, by the Institute of Health Policy, Management and Evaluation, and by the Council of Ontario Medical Officers of Health. The focus was very much on post-pandemic recovery and working towards a stronger, more resilient public health system. The lunch break featured a keynote speaker on leadership, success through resilience, and emotional intelligence. The afternoon saw separate section meetings, one for members of the boards of health and the other for the Council of Medical Officers of Health. The Board of Health section meeting included an update from the Association of Municipalities of Ontario and a discussion on how we can support human, environmental, and economic fitness in municipalities, cities, and provinces through improvements to our built physical and social environments. It was an informative and productive day with opportunities to hear not only from experts, but also from our peers in other jurisdictions across the province. As I've said before, I encourage all board members to participate in future Alpha meetings and events if they can. I would now like to invite the Vice Chair and Member Gower to also share their perspectives of the day.
Thank you, Chair. I thought it was an excellent day. It was my first time in participating in the symposium through Alpha, and I thought it was really great. I would echo all of what you said. It was very nice to come together with other public health units from across Ontario to really talk about our shared experiences and the recovery plan. And so truly, I think we're really in a good place in Ottawa in terms of using the data to inform our decisions. And so very proud of that work. I would highlight a few things that were really key in my learning. And so Dr. Tam really did challenge us to be thinking creatively about maintaining surge capacity for vaccinations, for contact tracing, because this will be part of our go normal, likely. And so to be thinking about how we use data and how we used data, and I think that's where I was particularly proud of how Ottawa has used data to really be seeking out where we see inequities and then moving to creatively work with neighborhoods to address those inequities. So I thought that was particularly relevant and also a proud moment. And I also, the other piece that I'll highlight, there was just so much from the day, I'm just looking at my notes, was the research from Dr. Sarah Allen from Toronto, where they really did look globally at some of the best practices, for managing COVID. It's almost like a worldwide control group as we, everybody was scrambling to do the best that they could with the resources that they had and approach things differently. But it really did highlight going forward about how the social inequities really do underpin everything that we do, so that in jurisdictions where social inequities were at the forefront, they really did fare better in COVID. And I think the research would support that's relevant in all of our health aspects. And so the more that we're doing to look sort of widespread and address those inequities, the better off we are. So I've got pages of notes. I thought it was a great day. Thanks for the opportunity to share.
Thank you. And one of the things I should have mentioned before I go to Member Gower is there are a number of shout outs to Ottawa Public Health. For data was one of them, collection of data and how we use it. And again, kudos were given by Dr. Tam, no less, for our approach to social media and messaging to our community. So I'm going to turn over to Member Gower.
Thank you, Chair. Yeah, I agree. It was a very interesting set of presentations. One thing I noted was, a lot of them were focused on the balance that public health organizations have had to achieve in Ontario and across Canada and the world, I suppose. COVID has impacted the ability to deliver services, and there have been some negative impacts. I mean, we heard about some of the impacts on the Ontario health system overall and overall health of our communities. But they did also highlight some of the achievements and some of the positive outcomes or positive changes, things that public health organizations have learned and built on, things like better data analysis and reporting, improvements to how surveillance is conducted in terms of overall health indicators, public and partner communications. And yes, Ottawa Public Health was highlighted as a great example of that. Better engagement and collaboration with stakeholders over the pandemic. A renewed approach to equity, and I think a better understanding overall, not only within public health, but more broadly within the political and public sphere about the importance of equity in public health, and just enhancements to emergency response as well. One sentence from Dr. Tam that stood out for me was she said, "The future of public health is at a neighborhood scale." And she highlighted the need for more stable core funding of public health units, as well as strengthening community connections. So that was a statement that's been in my head since Friday when she said it. And I think it's an important focus as we continue through the pandemic and through the recovery stage as well. Thank you.
Thank you very much. In closing, I wanted to note that with the provincial announcements earlier this month, about accelerated timelines rather for the reopening plans. We are entering a time of change with regard to COVID-19 restrictions. It is important for people to get back to seeing each other, being together, but we also need to be cognizant that for many, this may need to be a gradual process. Not everyone will have the same comfort level in getting back to in-person gatherings, meetings, or other events. Some people may choose, for example, to continue to wear a mask, even though they're not required to necessarily. People may be reluctant to shake hands as we used to on a regular basis. Different things like that we might see as we move forward with this. So I think it's important as we move through this next phase, this reintroduction, if you will, back into our community, that we need to exercise patience and above all kindness with those around us. That concludes my verbal report. I'd be happy to take any questions, and if not, we'll move to Dr. Etch's report. Can we receive the report then? Thank you, and we'll move to Dr. Etches for her report. And again, I would ask you to hold your questions for Dr. Etches if you have any, reminding you that we do have a citizen delegation today. We'll hear from the citizen delegation first and provide any questions to him, and then we'll move to Dr. Etches and staff following that. Thank you.
Sure, and I'm going to cover a few topics today, so you might want to jot your question down so you don't forget it later. But I do want to say good afternoon, of course, Kwe, Ulakut, Danshe, and Bonjour. And a little bit differently today, I want to start by considering the common stressor that the pandemic has been for people in Ottawa. And earlier in the pandemic, you may recall, as we were calling on everyone to protect each other against COVID-19 transmission, that Ottawa Public Health launched a campaign called 1 Million Reasons. Some people were being cautious about limiting COVID transmission in order to protect a grandparent, or others to keep a business open, or others wanted to stay healthy so they could keep doing their work as a healthcare provider. And I want to acknowledge today that there may be 1 million reasons to grieve. All the different losses over the last 2 years. Many have lost loved ones or lost employment. They've lost social celebrations of important milestones and educational achievements. The losses are unique, and some have been hit harder than others. And so acknowledging this common sense of loss, I want to call us as we move forward to be compassionate and kind to one another. We're making this transition from fewer restrictions, and we know there's still COVID in our community, but we're turning to recover our well-being. And this is a bit of a balance we have to find. Plusieurs ont perdu des êtres chers, leur emploi, des célébrations sociales, des étapes importantes et des réussites scolaires. Et les pertes sont uniques et certaines personnes ont été plus durement touchées que d'autres. En reconnaissant ce sentiment commun de perte, je voudrais maintenant appeler les Ottaviens à faire preuve de compassion et de gentillesse les uns envers les autres, alors que nous faisons la transition vers moins de restrictions et nous nous tournons vers la récupération de notre bien-être. And particular individuals and communities may require additional supports at this time, such as people impacted by the war in Ukraine and people recovering from the difficult experiences with the unlawful protest and trucks in their neighborhoods. Ottawa Public Health will continue to work on the ground with partners to address concerns raised by people most affected, while we share information and resources on how to address the harms caused by crises and emergencies that affect people across our city. And I'm thankful for the Ottawa Public Health team members who are scheduled 24/7 to support this work. So a month ago, as I reported at the last board meeting, the Omicron wave peaked in early January after a rapid rise. And this has been followed by a somewhat slower decline in our wastewater signal, test positivity, and new hospitalizations due to COVID-19. It is the case more recently that we're seeing that decline begin to plateau in some of the trends that we're monitoring. Hospital admissions, death, and wastewater signals have continued to slowly decline since about mid-January, but last week we saw a plateau in the percentage of people testing positive for COVID-19, and also a plateau in the number of new outbreaks in congregate living settings, which, like other indicators, had previously been declining. So we're continuing to promote vaccination and to work at increasing vaccination as an important protection. We're still offering on-site vaccination for businesses and faith-based organizations, community settings that request this service for people experiencing barriers to access. And as of last night, we've reached 88% of residents aged 5 and above who have 2 doses. That's 84% of our total population in Ottawa. And 63% of residents age 18 and above have 3 doses, which represents 52% of our total population. And so my great thanks go out to Kim Ayotte, Beth Gooding, Amanda Mullins, and the city and OPH leaders who mounted the emergency effort to provide people with booster doses and continue the 5 to 11-year-old COVID vaccination work. Je remercie chaleureusement Kim Ayotte, Beth Gooding, Amanda Mullins et les responsables de la Ville et de Santé publique Ottawa qui ont mobilisé l'effort d'urgence pour fournir aux gens des doses de rappel et poursuivre le travail de vacciner les 5 à 11 ans contre la COVID-19. The city's Emergency Operations Center has now moved to a monitoring status. And as the vaccine operations, planning, communications, and logistics are led from within OPH. The city staff continue to assist with facilities and some of the information technology aspects of the work. And we continue to recommend that all eligible residents get their 3rd booster dose as soon as possible. It provides protection against both symptomatic infection, transmission, and serious illness. The mortality rate during the Omicron wave was nearly as high as in the spring of 2020 at the population level, just given the sheer number of people infected. And there are still 25,000 people over the age of 60 who do not yet have their booster dose in the context of Omicron still in our community. My understanding is the provincial workforce is calling everyone who has 2 doses and needs that 3rd if they're over 50. Because older adults in particular will have a lower risk of hospitalization and death when they have that booster shot. So, as the chair noted, on February 14th, the province announced changes to the timelines for its reopening plans, including increases in social gatherings and capacity limits effective February 17th, and then the lifting of all remaining capacity limits and proof of vaccination requirements effective tomorrow, March 1st. So our current indicators show that the Omicron wave has not yet ended. Its descent may be stalling. And so we're going to keep looking at this. Federal modeling has shown that there are different projections, different trajectories we could follow, really depending on the impact of reopenings and what level of transmission continues. So we're not planning locally to recommend further public health measures as provincial restrictions are lifted. But it is clear that individual behaviors can either drive or deter transmission. So our objective continues to be reducing morbidity and mortality from COVID-19, keeping our hospitals functioning. So in order to achieve this goal, we will continue to promote vaccination. We're also promoting personal risk assessment, and that we all think about the mitigation strategies we can still use, such as daily screening, monitoring for symptoms, staying home when we're ill, frequent hand washing, the physical distancing, and reducing close contacts, being conscious about how many close contacts we have, increasing ventilation, and avoiding the closed, crowded settings, and continuing with masking in indoor public settings. So I want to state this plainly and clearly. just because some of the public health measures are being lifted, it doesn't mean that we're giving up on limiting the impact of COVID in our community. It's still important to keep an eye on COVID and to consider the risk of transmission and choose the lower risk activities. And we're still here to inform and support Ottawa residents with this. Je veux exprimer ceci aussi simplement et clairement que possible. Ce n'est pas parce que certaines mesures de santé publique sont levées que nous renonçons à limiter l'impact de COVID-19 sur notre communauté. Nous sommes toujours là pour informer et soutenir les résidents d'Ottawa. So we'll be monitoring key indicators, monitoring internationally for new variants, and continuing to work with community partners to support people at higher risk of severe COVID-19 illness. Learning to live with COVID doesn't mean moving on and pretending the pandemic is over. It's not. It means being mindful of the virus's presence in our day-to-day lives. And I'm confident residents in our city have gained new skills over the last 2 years to assess their own level of risk day to day. We drive based on road conditions. We wear helmets when doing activities that might cause a head injury. We change our shoveling tempo based on how heavy the snow is. There is a difference, though, that usually we're basing our decisions about the benefits and the risks on what it means for ourselves. But now we know the benefit of going to a restaurant or a gym or a concert is ours, but the risks are shared by those around us. We need to think of the people who are most vulnerable to severe infection in our lives. Things are changing, so it's going to take time for all of us to find our comfort zone. And it's important we respect each other's feelings during this time. Just because I'm comfortable or you're comfortable doing an activity doesn't mean that our friends or family members will also be comfortable with it. And these are difficult times. We know some people will welcome these changes. Some are worried about them, and others are really uncertain. So Ottawa Public Health will continue to work to give residents the information they need to make informed decisions about their own personal levels of risk in the current environment and tips and strategies to mitigate those risks. Residents of congregate living settings, so that's group homes, shelters, independent living, and correctional facilities, are at higher risk of exposure to COVID-19 because of shared spaces, sometimes crowding, and exposure to staff with asymptomatic or pre-symptomatic COVID-19 infection. So Ottawa Public Health engages with these community partners to prevent and identify and manage outbreaks. We've been doing preemptive site visits and promoting infection prevention and control education. So applying a health equity approach is integral in addressing the gaps that we see and supporting congregate settings and other high-risk populations that they serve. So we're planning to continue to maintain staff capacity to support congregate settings while ensuring that we're working with partners, others, city's Community and Social Services Department, Ottawa Inner City Health, Ministry of Children, Community and Social Services, and others in infection prevention and control teams regionally. We're really working together to think about how we also protect populations with higher risk. I wanted to come back to, you may remember when we were talking about outbreaks in long-term care and retirement homes, we had some delegates ask about this sector, about the congregate care sector. And so our team did go away and look at this. We provided a report last month, so it's on our website. I think that Deanne is planning to send you the link so you can find it directly, which is highlighting the lessons we've learned in managing COVID outbreaks in congregate settings. So we're going to follow up on a couple of other things that were raised to the board. So last meeting, the board requested that I work with the province to emphasize a cautious approach to reopening while the healthcare system was still under pressure. Unfortunately, our healthcare system is coping again. The number of hospitalizations is well down. But the board asked that I work with the province to identify the best approach for proof of vaccination requirements. In particular, whether to include the requirement for people 18 years of age or over to show proof of a third or booster dose, in addition to proof of their first and second doses, in order to access business and community settings where people are required to provide proof of vaccination until tomorrow. And so I can report I've reached out to the province to seek a review of the evidence to guide the approach to vaccine policies and otherwise increase vaccine uptake in our current context. So at this time, our provincial partners are recommending focusing on targeted approaches to reach people in different populations that are unvaccinated or under-vaccinated. So they're recommending scaling up efforts with primary care physicians, with pharmacies, mobile vaccination clinics, school-based vaccination, having healthcare providers make recommendations and institute reminders and recall systems, and using public health communication campaigns, as well as community leaders to work to increase vaccine uptake in identified communities. So these are all things that we're pursuing. And as previously noted, the requirements for proof of vaccination will be lifting, but businesses and other settings may choose to continue to require proof of vaccination. Given the language in regulations released on Friday, February 25th, local medical officers of health no longer have the ability to issue letters of instruction to require vaccination in any setting. And our letter of instruction requiring immunization of coaches, volunteers, and officials who support organized sports in indoor settings has been rescinded. At the last meeting, I also committed to seeking clarification from the province with respect to new isolation requirements that had moved to 5 days. And the question was versus, say, 7 days. So we followed up on this, and I can advise that Public Health Ontario has noted that Omicron displaced Delta as the dominant COVID-19 lineage here in Ontario. And we know that Omicron is more transmissible. The period of communicability appears to peak at an estimated 3 to 6 days post-symptom onset, which is slightly shorter than that of previous variants, which were estimated to peak at 3 to 8 days post the symptom onset. And so shortening the isolation period for people who test positive and the quarantine period for contacts is really aiming to balance the risk of residual transmission after the 5 days versus the burden of staying home on individuals and households and the workforce, particularly essential workers. So with the risk of further transmission, if someone does leave isolation while infectious, the Public Health Ontario has identified a number of considerations which have been incorporated into provincial guidance, such as having differences based on vaccine status and considering avoidance of specific settings where risk tolerance would be lower because of more vulnerable populations. So not visiting long-term care homes, for example. And it is important to note the province is the lead for establishing case and contact management guidance. This is important for consistency across the province. And any local deviation from this guidance would cause confusion, but also would need to be justified by local circumstances. So as previously mentioned, we have been observing decreasing trends in transmission across the city, looking at wastewater hospitalizations and test positivity rates and outbreaks. So we will continue to follow the provincial lead. Still with me, I'm going to switch to the budget. You will get formal budget reports at our next meeting, but I did want to let you know that to date, the Ministry of Health has provided a total of 84 million one-time funding for 2021, both the COVID general response and the vaccine program, based on our expenses submitted and our preliminary projections. This includes a reimbursement for the costs incurred by partners, such as the City of Ottawa, for delivering the vaccine campaign. However, there were additional expenses that were incurred in the last part of 2021 due to the surge of Delta cases, also continued community outreach to increase vaccination rates, and then the rollout of the 5 to 11 vaccine and the need to administer boosters. So we are submitting an additional request for $4.3 million to cover these extraordinary expenses as part of our fourth quarter activity report. It is anticipated that provincial funding will fully offset this cost and balance the budget. For 2022, the ministry has renewed the $3.1 million of funding, which mitigates that reduction in the cost shared formula, the way they're applying it, considering a 70% provincial, 30% municipal share. And also, in an effort to address increasing public health program costs and demands, the Ministry of Health will be reviewing the 2022 grant request for our public health programs within a provincial base funding envelope that's going to provide for up to 1% growth funding. So this is something we haven't seen for a number of years. As part of our annual service plan submission to the ministry, we are requesting one-time funding in line with what the board approved. So that's one-time funding for more vaccination, more COVID response, and recovery efforts. And our expectation is that the province will continue to fund all COVID-19 related expenses through 2022. One moment. Brief comment on Ontario health teams. In January, Ottawa Public Health reaffirmed its commitment to the Kids Come First health team. We signed their collaborative decision-making agreement as an organizational partner. So this formalizes our ways of working together, and it aligns with our involvement in other local Ontario health teams. We also learned the Kids Come First health team has been awarded a one-year Canadian Institutes of Health research grant. So this grant will support ongoing work of One Call, One Click, which is providing a one-stop point of access to mental health and addiction support for children and youth. So congratulations to them. The rest, pretty much the rest of my update, I want to speak about looking ahead. So just going to see, I believe this is where Deanne is going to share a slide. Yes, she is. Okay. So we have been advancing recovery planning for our organization, for Ottawa Public Health to return to more of its mandate. And we're using some principles to guide our recovery. There's four principles. One is to be proactive in defining our work. Yes, in reference to the Ontario Public Health standards and requirements, but also based on community need, the capacity we have, and the evidence for what will have an impact in promoting the health of our city. Secondly, we are seeking to align with City, Ontario Health, and other provincial plans. And thirdly, we're focused on prevention, which we see as a fairly unique role of public health in the health system. And we are fourthly working to engage provincial public health partners. So this I think was part of the conversation that board members mentioned in terms of thinking about what other health units are doing, what's the province doing to strengthen our public health system. So this roadmap now is what's being projected is the approach that we're going to take to transition from where we currently are, where addressing COVID-19 is taking up a lot of our time. It's shown in that tan color on the bottom. And we're going to move to the far side where ultimately COVID-19 will be part of our routine operations. And so there are different streams of work. We're first having to identify what is this recovery planning work, and we've done that in the top color there. These colors are hard to name actually when I look at them. And so as we go first, we're defining what that recovery work is that we need to do. And then like how we'll approach this. Then we have the recovery needs that we're identifying, and that's really where we're at now. All through this, we're keeping our strategy in mind. So the board direction that you've given us, what our goals are, how we need to focus on mental health and substance use, health, how we want to build healthy communities, we want to promote equity. That's the blue strategy running through this that we're seeking to implement that action plan. The green here is representing our usual operations, our key programs and services, which, as you can see, we're planning to restore. So this 5-step roadmap is giving us a way forward. You can see the timelines at the bottom are sometimes a little bit flexible or unknown. And that's because we do know that we're still facing some unknowns with regard to the pandemic. But as I mentioned, we're in step 2 of the roadmap, where we're working to gather input from diverse groups to inform this recovery and to identify the population health needs that we see now and into the future. So we've started consultations with public health leaders. Internally, we're reaching out to employees next. We've worked to connect with City of Ottawa partners and beginning as well with external partners and stakeholders. So your turn is coming up. We are planning that facilitated session with you in March to receive your input, and we'll really do look forward to that being an interactive session. We are going to then come to step 3, where we need to make decisions about resource allocation, and we need more input still and consensus building about what our proposed new areas of work will be, and we then we'll have to look at, as COVID allows, scaling back our COVID response step by step, remaining flexible. And then I think lastly in this approach, I just want to say that we're also considering key mindsets as we go forward. So our mindsets are to focus on collaboration, equity and community involvement, and also feasibility and sustainability. So look forward to speaking with you more about this. And also, as we do this information collection and thinking and collaboration, we are looking at how this can inform the broader community's recovery. So many Ottawa residents will need time and space and supports to meaningfully recover. The pandemic has disproportionately affected Ottawa residents who faced health inequities prior to the pandemic. Dans le cadre de la planification du rétablissement de santé publique Ottawa, on examine aussi comment on peut aider la communauté à se rétablir. De nombreux résidents d'Ottawa auront besoin de temps, d'espace et de soutien pour se rétablir convenablement. La pandémie a touché de façon disproportionnée des résidents d'Ottawa qui étaient confrontés à des inégalités en matière de santé avant la pandémie. So community recovery is an opportunity for economic, social, and health stakeholders in collaboration with communities and individuals to come together to assess how our community needs have changed and to shape and adapt services together. So our restored and reimagined services and programs will help advance community recovery, and this work will include cross-sector collaboration. So community recovery is bigger than Ottawa Public Health, and it will need to consider the interconnectedness of partner and city services and the complexity of community needs. So we're envisioning a day when many diverse partners and stakeholders will share in a coordinated effort to help all Ottawa residents recover economic, health, and social well-being. And really, each of us can play a role in rebuilding social connections and opportunities to thrive. This is the time we're entering into now. With respect to economic recovery, we are acknowledging and understanding, of course, that public health measures and provincial restrictions have negatively impacted the business community. And workplaces have had to adapt to very different work models. some employees on site, some at home, and then planning for an eventual return to work in person, while others have had to close due to restrictions. So in every situation, employers and employees have been affected by changes. And so our team has developed Working Towards Recovery, a workplace health and wellness guide. This guide was developed to support mental health and wellness of employers and employees in the workplace. And the strategies and tips in this guide will be helpful to workplaces who provide services virtually, as well as workplaces providing in-person services and activities. So it's been shared with some partners from Ottawa's business community, and we're looking to promote it more broadly in the days and weeks ahead. As you know, improving mental health and substance use health of Ottawa residents is a priority for us. And so it's important that we think about mental health as part of our overall health, and positive mental health as core for our well-being. And yet many of our residents are having their coping strategies being challenged. Ottawa's worked with partners to increase the supports that are available given the increased demand. And what we're doing, our role is providing data, collecting information about the needs, fostering collaboration, looking at how people can promote well-being, and also become more aware of the existing services. We know that it's very natural for the recent unlawful protests, the war in Ukraine to affect our mental health and loved ones. So the way we've been addressing these things recently is through the Human Needs Task Force. It was established early in the pandemic response, and it is, continuing to be a collaboration of city partners and various key community partners to assist residents with many different types of needs. They're food security, housing and social services, and employment supports, as well as safety and mental health needs. So we've been working very closely to make sure that those mental health resources are provided, that connections are made with service providers who can provide mental health and substance use health counseling and other services in the community. Throughout the unlawful protest, through our communication channels and our partner networks, we shared resources and strategies on responding to stressful events. And we're also encouraging residents to reach out for the supports when needed. We have been also working through existing partners like walk-in counseling clinic to connect people to those services. We connected the Somerset West Community Health Center, Centretown Community Health Center, and the Human Needs Task Force with the chair of the psychiatry department at University of Ottawa. And these kinds of connections lead to further mental health services and outreach that could be helpful. Also working with partners in the Ottawa Black Mental Health Coalition. There's a community conversation taking place this evening, I guess very soon at 6:30. And it's an opportunity for residents who've been impacted by the images and the acts of aggression to come together and share experiences. We've also been working with the Ottawa Black Mental Health Coalition to prepare for Black Mental Health Week, which is starting tomorrow through March 7th. There are going to be a series of educational sessions highlighting the leadership and innovative approaches for African, Caribbean, Black mental health and wellness. And internally, as the chair mentioned, we have been promoting Black History Month, and I'm encouraging our team to continue to access resources that we've shared to counter anti-Black racism. And in terms of promoting mental health directly in our communities, so our team members, Ottawa Public Health is implementing several pilot wellness hubs in the locations of the neighborhood vaccination hubs. This will be a pilot beginning towards the end of March, and it will support residents' questions on mental health and substance use health. We'll be providing tips and resources on being well and connecting residents to social services through a partnership with the Community and Social Service Department, employee and social service teams. So these hubs are going to also operate in partnership with Access MHA, Counseling Connect, and One Call, One Click, so that OPH team members will support residents with direct system navigation into these services at these locations. It's neighborhood-based. Also earlier this month, in partnership with YouthNet at CHIO, together we launched comprehensive e-learning modules for youth on mental health and stigma, stress and coping, and relationships and peer support. So these e-modules include lesson plans for teachers on all 3 topics, and they were developed in collaboration with youth from across Ottawa through YouthNet's advisory committee. And these new e-tools and modules will help students develop skills and knowledge for mental health literacy, wellness habits, stress management, coping tools, positive peer support skills, and help-seeking behavior. So the last note related to mental health and substance use, it is important that we recognize people will continue to experience things in their own way through this time of transition and change. So we know that we can support each other using positive coping strategies. Each of us need to continue to make time for ourselves and to not hesitate to reach out for help when it's needed. It is okay to not be okay, as we say. And asking for help is not a sign of weakness. It's really a sign of courage. So I'm going to conclude with 2 key messages that I hope have come through in my comments so far, but just to go back to them, to repeat them, and to say these 2 key messages may sound contradictory, but we have to learn to do them both. So first, the decrease in Omicron in our community, it may be stalling, and as provincial guidance changes, we are shifting to individual risk assessment and risk mitigation, which is important to continue. La diminution d'Omicron dans notre communauté est peut-être en train de ralentir, et comme les directives provinciales changent, il est essentiel de passer à l'évaluation et à l'atténuation des risques individuels. So this means, especially if you or someone you live with is at risk for severe COVID illness if infected, that you can still decrease your chances of infection by being vaccinated with a booster dose, wearing a mask in indoor spaces, practicing physical distancing, and being careful about the number of close contacts, time in crowds, and time in closed spaces that you have. Secondly, social connections and engagement in workplaces in person are an important part of recovery from the pandemic. Les liens sociaux et l'engagement sur les lieux de travail en personne sont des éléments importants du rétablissement après la pandémie. And so this means I do encourage people to connect with friends and family, to return to in-person meetings, and to support local businesses, keeping in mind your own risk assessment. People of all ages have been affected by social isolation, and we can each help to reestablish health-promoting connections with others. And again, compassion and kindness towards people with different needs at this time is essential. And lastly, I'm sneaking in one more thing before I take questions. I would like to recognize the work of Ashley Brambles. Ashley Brambles has made the difficult decision to move on from her position as Director of Communications and Community Engagement to take on a new role in the City of Ottawa's Infrastructure and Water Services Department. And I know you'll join me in wishing her well and thanking her for her work with us through these toughest times of the pandemic. There's no question that Ashley has served Ottawa Public Health with dedication and passion. And Ottawa Public Health networks and partnerships have expanded under her leadership, and her expertise in government and stakeholder relations will be missed. She's grown the communications and community engagement team significantly, adding in a new focus on priority populations and different sector engagement. The call center has adopted new ways of working in an environment of unprecedented demands, and she provided strategic guidance to the communication team that has been recognized for stellar public health social media communications internationally. She's really worked with the team to maintain confidence in our Board of Health And as the medical officer of health, I have relied on her for strategic issues management on many, many subjects. So I'm also pleased to say that Jessica Breckenridge has agreed to serve as the acting director of communications and community engagement. So I'm sure Jessica is online now. And this will be as we do an internal and external, really national search for someone to fill the role permanently. And Jessica should be known to many of you because she's worked on strategic issues management with teams across the department and with many elected officials. She will continue, of course, to work with the other strong leaders in communications, community engagement to advance our work. So now I'd be happy to take any questions.
Thank you, Dr. Etches. And I want to echo your comments both about Ashley and Jessica. Very sorry to see Ashley move on, but she was a great asset to the department. I'm sure she'll be a great asset to the city, and really looking forward to working closer with Jessica in coming days and weeks. Before we go to questions, Dr. Etches, we do have a public delegation that we'll hear from. And then, as I indicated at the beginning of the meeting, members, you'll have an opportunity to ask Dr. Etches and staff questions. So we have Mark Cirillo. Mark, are you on the line?
I'm here. Thank you.
Mark, you have 5 minutes to make your presentation, and I'll turn the microphone over to you.
I'll do my best. Thank you very much.
You.
Thanks, everybody. My first time at one of these things, so appreciate the time. I heard a couple things today that really are kind of congruent with the message that I want to present today, which is rebuilding those social connections, individual risk mitigation, and the provincial restrictions that are slowly fading away, I guess you could say. Specifically, I want to talk about the masking on the children and bringing back the smiles back into our schools and our school system. I know a lot of mandates have been dropped in many different areas, but I feel like the children in a lot of ways have been left behind in this story. And I feel like we're at a good point where we should be going there. Next slide, please. In line with the data that we talked about, or provincially, I think you talked about the good data usage. This data is hospitalizations in Ottawa from OPH, actually. And in line with what Dr. Etches was saying, I think you can see that the trend is drastically down. And I think you could probably say this is the lowest the hospitalizations have been throughout the pandemic. Somebody could challenge me on that, but I believe that's the case. And even further into the 24th, 25th, 26th, there were 0 hospitalizations on a couple of days, and there's like 1 or 2 here. In the past 7 days, it's been extremely low, very minimal footprint in ICUs, et cetera. Next slide, please. I don't see a timer going. Former director of the CDC, Tom Friedman, says 18 months ago, it would be irresponsible to say, and I think everybody would agree with this, that COVID is similar to the flu. Many people hospitalized or dying just have positive tests, are not sick from COVID. And it's most important to protect the vulnerable, which I think Dr. Etches alluded to in her statement as well. Omicron is different, and I think I don't think that's in question now. And COVID's adapting to us. We need to adapt. Next slide, please. This is another one of the hospitalizations. And I wanted to note here, a particular importance is that during the unlawful protests, I would say tens of thousands or even 100,000, I don't know exactly what the number is, but I think within this period where the hospitalizations are extremely low and somewhat non-existent, during that time, there were, passing through the streets of Ottawa in hotels, in restaurants. There was much close contact between the population. And, so basically what I'm saying is there was no spike in hospitalizations, with probably hundreds of thousands of people going through Ottawa from all over the country. Next slide, please. Sorry, I had to get some water there. In terms of recommendations of removing the mask for children in schools, I got a lot of quotes from Deanne for recommendations from the CDC, et cetera, which I think is great because they just modified their recommendations. And the map on the bottom left there of the US is low, medium, and high. Ottawa fits into the low category where masking indoors is no longer recommended. That chart used to be completely red. These are new recommendations. You can look up the link from the CDC, which basically say that mask recommendations are on their own. In Britain, they haven't been wearing masks. In the UK for probably over a year, I would estimate. Next slide. And I think others, Saskatchewan has also removed theirs. Next slide, please. Alberta's already removed theirs. Next slide, please. And these are kind of the estimated dates, whereas you can see Ontario doesn't have one as of yet. And I guess my proposal to the board is that we should have one in Ottawa. Next slide, please. That's the New York one that has just removed their masking recommendations for schools. And just notably, I put New York in there because they had very close recommendations to Ottawa's masking mandates. And on top of this, more, other than the unlawful protests, I mean, I think you can see practically that there are across major sporting events like hockey games, the Super Bowl, all these different events that are occurring right now where nobody's wearing a mask. And yet our children are still stuck with wearing masks, hours and hours during the day, during recess, getting sent to the principal's office, et cetera. I'm going to finish up here. So my proposal is this: COVID is now endemic, and that can be argued, perhaps, and will be argued. Many have said it is endemic. Many have said that we're still in the height of the pandemic. But I think practically speaking, I think we know we're on the tail end here. And the children need to return and heal and start rebuilding those social connections. Many haven't seen teachers without masks on, or haven't even been able to look at, their whole school life has had masks on. Vaccination and booster rates are extremely high. And mainly Ottawa is not Toronto. We're not the Peel region here. Our profile is completely different. Hospital and case rates have been the lowest that we've ever seen. So my recommendation, I'm not sure where I am on the 5 minutes. Tian, I don't know if you know.
You're past the 5 minutes.
Oh, okay. Last line. Sorry.
Okay. Thank
Last
you.
line right here. So my recommendation is I think Premier Ford, and I think they are going to make a move to remove them in school settings. I believe it's going to be after, I don't know what everybody thinks, but I think it's going to be after the March break is my estimation. But my recommendation to Ottawa would be, we're a different profile here. We're much smaller. Our hospitalizations are very low. And it would be to make a recommendation to the province that we lift them immediately in Ottawa, and Ottawa could be used as the test bed for that. And that's all I have to say. Thank you very much.
Thank you very much. I'm looking to see if there's any questions. Yes, Member Gower has a question.
Thanks, Chair. Thank you, Mark, for your presentation. I'm just curious if you have school-age children.
I have two, yes. I have school-age children, one in grade 6 and one in grade 7.
And you touched on it a little bit, but I'll ask, what difference would it make in their day-to-day lives to not have masks in the classroom or in the playground?
You could go into there are many different studies done on the benefits of masking. To me personally, I think the benefit is the social interaction and that rebuilding the social connections that Dr. Etch has talked about. To me, that's the most important thing for the children, to be able to see smiles, see each other's faces. And, I don't want to go too much into the science. I know there's a lot of different studies on the oxygen and the carbon dioxide and all this other stuff, but I won't go too much into that. I'll just say for me, mainly it's the social connections. Many have said to me, our children love being masked and it's not a problem. And it's something that they just do and they're happy to do it. And I do agree that children, they very much have listened extremely well and they've done their job over these past 2 years. But I think if you give them the option, they'll throw the mask in the trash. And I think that, I do agree that it should be rolled out slowly. There is going to be some pushback in many different areas. Some children are not going to want to remove it for a while. And that, I think all of that's fine. I think optional is a great approach, and slowly roll it out and get the children back so they can see each other's smiles and playing with each other again.
I tend to be on side with you, especially for outdoors at recess. And I agree. I think, I wonder though about the comfort level of parents of letting go of masks. And do you have any thoughts on how that could be addressed through communications or education? How big of a concern is that?
I think it would be, I would recommend to the board that could be definitely something that would be addressed with the parents, saying that, we realize that some of you are going to be apprehensive about this, reassuring them. There is, everybody who's got vaccinations and boosters has them. Again, masking, if they feel more comfortable masking, I think we should slowly roll out that idea to them and say, look, we're not telling you don't have to wear a mask. If you want to wear a mask, that's fine. If you don't want to wear a mask, that's fine. If you want to wear it today and not tomorrow and try it out and see how it feels, then that's fine as well. The numbers are extremely low. And there has to be at some point a risk benefit done again for the children that are wearing these masks for hours a day. So at some point we have to do that. It's been 2 years, and Omicron is although it can be serious, it is not as serious certainly as Delta, I think, is the general consensus globally. And at some point you have to say, we don't know the long-term impacts of children wearing these masks, especially the ones that haven't really communicated or having trouble speaking because they can't see the teacher's face. I think that all needs to be taken into consideration. But to your question, I think OPH could provide some excellent guidance to parents on this and say, look, we're going to be the first. Our hospital rates are very low. We're going to roll this out very slowly. We want everybody to be confident. You're doing the best for your protection. And I think Dr. Etches spoke about individual risk mitigation, which I picked up and wrote down, because I think that's the phase that we need to move into. It's if you think that you need a mask or you're high risk, then definitely wear the mask and make sure that you have your vaccination schedule, et cetera, done.
Okay. Thank you, Mark. Thanks,
Thank
Chair.
you.
Thank you, Member Gower. Mark, I don't see any further questions. So thank you for coming out tonight.
Thank you very much. Have a great evening, everybody.
So that's I believe, Deanne, that's our only public delegation, correct?
That is correct, Chair.
Would you,
Okay.
Chair, would you like me to speak to that?
I'm going to go through the list then for members to ask questions of Dr. Etches and staff. I'd like to start it off quickly. Dr. Etches, we just heard a lot of information from the public delegation, particularly about our hospital rates being the lowest ever, that we're now at an endemic stage of dealing with COVID in our community. And a number of other things. I'm wondering if you want to have an opportunity to respond to what we heard in that presentation.
Sure, thank you, Chair. I really respect that everyone's trying to find the way to get back to more usual ways for children to be in school. And I think there are a couple of pieces that I could bring some data to bear just to correct a little bit on what that situation is here in Ottawa. But overall, I do understand, many people are looking for a change in masking requirements, and some people don't want to change in masking requirements. And so maybe just right off the top to say, I can't change masking requirements in Ottawa schools. So that is a provincial approach, a Ministry of Education requirements. I do believe they're under discussion. So I think, we will see the province continue to look at mask mandates and any changes there across Ontario in many different settings. And I would expect as they change things in other settings, they would also be looking at schools. So I don't have any further details on the provincial plans, but I know these are being discussed and looked at actively. And I would like to say I do agree with the idea that if there comes a time when masks will no longer be required in schools, we want to respect that some people will want to continue to wear them. And it's a big transition for some families, for some children. I just spoke about families have different risks and they may need to take different approaches. And we need to be, conscious and compassionate about that. We also have thought about the need to communicate to parents about how to talk about this change to children. So our communications team is developing messages that can be used for parents as the restrictions and the mandates change to help parents talk to kids about the changing situation. So I think maybe just to clarify though, like our current situation, it's actually still quite a bit of Omicron in our community. Right? So we're not at an endemic stage where things are stable. Our hospitalizations have been lower than they are at this point. We had higher population mortality rates with Omicron compared to Delta, just given the sheer number of people that were infected. And we know, the other jurisdictions that were mentioned in the presentation have also had challenges with higher mortality rates. So Ottawa is in fact similar to the rest of the province today in terms of our trend with the amount of COVID in the community. We're very similar to Peel and Toronto. The North is experiencing a bit more Omicron than the rest of Ontario. So I think these are just other things we want to think about in terms of the context. We don't want to minimize that some conscious effort to reduce COVID transmission is still required. Now, whether that will include masks in schools, a month from now, I don't know. So we will do our part to help people prepare for any kind of transition that's coming. But as I say, this will be a provincial mandate.
Thank you for that clarification, Dr. Etches. I think that's important for the board to hear. Now going to the list of board members, first up is Member Tilley.
Okay, thank you, Mr. Chair, and thank you, Dr. Etches, to you and your team again for the excellent work. So you've pointed out a bit of, Omicron is still out there. We hear rumors now and then the next variant could be coming. Obviously, we're in a world and certainly in a city here that wants to move towards we're done with this, or we want to learn to live with COVID. Is there a fear of once we get out of lockdowns and out of outbreaks and move towards even mask going and no longer having the restrictions, we're going to see some of those lifted tomorrow? If there is another outbreak on the horizon, I'm hoping not, but let's say there was one, is there a fear of how difficult it would be to start to ask for things to come back in because, like lockdowns again or that? I think there's such a frustration. I imagine it would be hard to get people to go back there one more time. I'm hoping this COVID is running its course, especially with the third shots and the immunization around the globe. But what is your thought on that? I heard Dr. Cushman at our board meeting say the other day, there's medical science and there's the science of politics, is also the political will may not be there to enforce some of these measures. So do you have any thoughts on that, or are you confident that maybe finally we're moving beyond COVID and we will be in a position of living with COVID?
Well, I do understand the burden and the harm that has come with trying to control COVID. I don't want people to forget why we used all those measures. I mean, this is not flu. We've had many more deaths just from the Omicron wave than we would normally in a flu season, right? So things would have been a lot worse in terms of lives lost without measures. And we would always like to do what is the least restrictive approach. We'd always like to have targeted measures, things that cause the least harm. And our elected officials are the key decision makers here in terms of assessing the balance of harms, different types of harms, health and economic and otherwise, and representing the community in making decisions. So I think we want to emphasize the things that individuals can do and make it as easy as possible for people to have that third dose. It has made a difference in terms of how much severe illness and things would have been a lot worse with Omicron without those booster doses. And so we'll be working with our healthcare partners too. I think it's very important when we think about it's the hospitals that get under pressure. It's the hospitals that have to cancel surgeries. And so we'll really be looking to them to advise on how they're coping. If we go through another wave, are they able to manage? You know, I think we've learned a lot, and we have some treatments now that are available, and we'll see. But our role in public health is to monitor. So we will be monitoring and seeing what is emerging, letting people know if we need to adjust our behavior. And really, people in Ottawa have done that when they've seen the rates rise. They've limited their contacts. You know, they've made decisions that would decrease COVID transmission. So I think we'll take it as it comes, but knowing, of course, there's a balance needed. You know, the social connections are really important, and so that's why at this point, with good trends, you know, we're trying to use this time of improved situation to focus on the other things that help us be well.
Thank you.
Thank you, Member Tilley. Member Pinnell, please.
Thanks. Thanks, Dr. Etches, for your very all-encompassing presentation. Very interesting. Now, I do have a question. I'm often asked by people, I've had COVID, I had my 2 vaccinations, I have COVID, so this means I don't need a booster dose. Or others will say, how long should I wait before the booster dose? Can you give us a scientific recommendation? Because the US and the UK don't actually give the same thing, so.
Yeah, we haven't had a recommendation for a little while from the National Advisory Committee on Immunization, which is what we follow. And so people heard different things. We had different recommendations, like get vaccinated right away or wait 30 days. So now we do have a formal recommendation from the National Advisory Committee on Immunization, which is to wait 90 days after you've been infected with Omicron to have your booster dose. That is likely to give you the best protection, longer lasting. And yet, of course, most people don't know if they had Omicron, right? Most people are assuming they had Omicron if they had a cold in January, but we don't always know. It wasn't always confirmed. So, you know, people can get their booster shot. There's nothing preventing them from getting their booster shot if they've had 2 doses and they were ill and they think it might have been Omicron, they're not sure. You know, you can still get your booster shot, or if you're pretty sure it was Omicron, you know, you can wait those 90 days as well. But I would say still get your booster shot after you've had Omicron, because there's no harm. And there is, you know, suggestion that the vaccination can provide more robust protection.
Thank you.
Thanks very much. Next up is Member Menard.
Thank you very much, Chair. Thanks, Dr. Etches, for your presentation. I want to send a huge thank you to all of Ottawa Public Health, who have been just really fantastic to work with. have been on the front lines and have, demonstrated care for people while having resolve in getting through this time. So really can't thank the people, frontline workers at Ottawa Public Health enough for all that they've done, and everybody that's been seconded into the health team from other areas of the city as well. It feels a bit surreal to be here at this point, almost 2 years in, after I remember us talking about this, before the wave started. I remember being in that small room before our Board of Health meeting. We were having sandwiches and some drinks there, and we were talking about what this would look like, what this would mean. I remember asking the question, what does this compare to the flu? And, it just was so unknown at that time. And it feels surreal to be here 2 years later. So thank you for everything. And Ashley Brambles as well, I want to congratulate in that position and for all of her work in liaising with us. I guess the question is really around the World Health Organization, who's talked about another variant that will inevitably come our way, and that's what they say on a regular basis. And so, is that very much going to be very much like a wait and see approach in terms of how serious that is and how not serious that is, and about which direction we go at that time, and we just adjust at that time? Or is there anything more that we know about that in terms of precautions now and the 5 states, that we can be ready for when that comes?
Right. So I think the monitoring system is the first thing that we'll maintain. So that's been in place for 2 years. We're going to maintain a system of surveillance and monitoring to be able to detect either internationally something's emerging or locally we're seeing something. The other thing we want to maintain is the ability to vaccinate quickly if there is a different vaccine that's needed for a new type of variant, something like that specific. We also are working to maintain our capacity to protect more vulnerable populations. So more work with congregate care settings I mentioned today than we have done, and to maintain that focus on infection prevention and control and really protecting more vulnerable populations. We don't know what direction variants will go in terms of more severe or less severe, more transmissible or not, and how much our existing immunity will last and assist. Right now, there is a fairly high level of immunity in our community. So that, we just continue to assess that immunity as well. So there's provincial level surveillance about how well are vaccinations to date protecting us against the COVID that's circulating, and looking to see if that's changing. So it's not waiting to have all of the capacity to respond, but we have to respond appropriately. We don't want to go into lockdowns exactly, as was previously mentioned, unnecessarily. If we can take more targeted approaches.
Yeah, and that just rolls into the next question, which is my last question, Chair, which is just around the mental health effects for kids. We know the sick kids studies that have come out and other studies that have shown how difficult this has been on our children and on their mental health. And just, you've been a strong advocate for schools remaining open in Ottawa. But on our end, Ottawa Public Health's end, I think we've got a lot of work to do when it comes to mental health issues coming out of this as well, out of this wave anyway. And so what does that look like in terms of our support for mental health in our community and within our kids and our children? I know we're in the schools, but what does it on the ground practically look like in terms of needed investments and work to get to individuals who may require more care than others in certain communities?
So our our unique way of approaching the mental health needs of our community is to think about the whole population, and then also to take a more targeted approach and provide support where it's most needed, or link people to support. So when we think about the whole population, certainly this time of saying to families, it's okay for you to connect with other families again, right? This is important for children's health. That is something on its own that is useful for children's health, is to be able to connect with other children. And then we know that other things are important for well-being. So staying active, being able to have the supports children need in schools. And I think we see this evolving in the education sector. Some summer school supports are needed. Those kinds of things also are important for health. We also know that when we can promote things to the whole population. One of them is then about, if you're having more difficulty, where do you get help? And that's really key. We see that survey after survey, people don't know where to turn. And we're trying to change that so people know where to turn, and that's part of our work. Then it's about, when they turn somewhere to get help, what's there. And that's our partners in the healthcare system, where we've helped as well connect and collaborate to create new things, online tools, walk-in counseling, things that I spoke to. The Kids Come First has been really essential around one call, one click, one point of access. So helping parents understand what's there for them to access, and the supports. We also then do our own team, have some staff that are directly promoting mental health in homes. So we have nurses and home visitors who are working with families where there are children under 5, after the birth of a child, even prenatally, but preparing the environment for the child where there could be even more concerns. Parents who have mental illness, who have children with more challenges to their development. So that's where our nurses and our home visitors are directly working with individuals. That service isn't available to every new parent. It really has to be targeted to people facing the greatest challenge. If we had more money, we could probably do more of those home visits. That's one thing. I think the other thing I spoke about tonight, which is a direct connection with individuals, is something we're trying. It's new. So we're looking at what are the new things we might do given the new needs in our community. And so this again is a bit targeted to neighborhoods where we've seen greater challenges with COVID. So trying to be right in the community in these neighborhood hubs to help people link to not just mental health counseling, but I may not have been clear enough, but the social services and employment services that people need. Like, it's very connected. When people look at the needs of people presenting with mental health challenges, at least at the adult population, 30% have social service needs as well. But it's hard to be well if you're struggling with housing. So, these things are linked together, where, it's hard to draw the boundaries about what is affecting mental health, because obviously many sectors are going to improve. If we can get people back to work and parents back at work, that helps their children's mental health. So really, the last thing I would say specifically in our own program, direct links, is in the schools. So we have the school nurses that have been fairly focused on outbreaks in schools and mitigating COVID transmission, but we have nurses with health promotion backgrounds who again are there to use the tools like the YouthNet e-modules and promote peer-to-peer work and capacity building for youth to be able to get through this time and into the future, have skills for coping and resiliency and supporting each other. So I think the other thing we've learned in the pandemic is it's not one size fits all in terms of mental health promotion or services. This is why we very much appreciate the coalition that's come together around Black mental health. We're part of that work, and that's another avenue we're going to continue to to develop is how we support different communities with their different mental health needs. So I think this is part of reimagining where we'll go. We're still listening a bit to communities about what specifically they think we can do. You've heard me speak about the other role, of public health, which is that monitoring and surveillance and sharing data about what's happening so others can use that information to provide the right kinds of services as well. So that's progressing our dashboard for mental health and substance use health. Really, they're very linked.
Okay, thank you very much. And Chair, I just wanted to follow up to, I know that's my last question to it, but there was a motion passed last meeting, and I don't know where those conversations have gone. Safe to assume, I guess, that is not something that, in third dose mandates, it's not something the province is looking at in any way. I don't know if the conversations with Dr. Etches and the province had talked about, say, other waves or anything like that, but I know I just wanted to hear if there was an update on that motion that was passed by the board last meeting.
Which motion are you referring to, Member Bernard?
Yeah, it was the
motion regarding vaccine passports, or?
Yeah, the third dose piece that had come up, but we had a
yeah. I tried to cover that off
about it, and
yeah, sorry, I tried to cover that off in my verbal update. So we did have the conversations with the province. They really pointed to other ways of trying to increase vaccine uptake right now. So rather than mandate to add the third dose, which you can see they're not doing, they were pointing to use different channels to make it easier for people to access vaccine, work with healthcare providers more, primary care, for them both to do their own vaccinating or to help remind and recall people who don't have their boosters. So sort of that targeted work is really where we're going now to try to continue to increase the vaccine coverage.
Okay, very good. Thanks so much. Thank you, Chair.
Thank you. Next up is Member Kavanaugh.
Thank you very much, Chair, and thank you, Dr. Etches, for all your presentation. It's nice to see that normal or new normal is at the end of that roadmap. We're all hoping for that, and thank you for getting us there. Yeah, it's been a rough few weeks, and I think that mental health is suffering big time, and I think that what's been really tough, and this is what I'm just starting to get out into the communities again. I just had a couple of events, and it's been new. They're outdoors, but just talking to people. And I think the effect of what happened here in Ottawa has a psychological effect on people too, on their mental health. Just the backlash against public health measures. And I think that's been tough on people too. And I'm just wondering how that's being recognized. I mean, obviously down in Centertown there, it's particularly awful. And I appreciate you mentioning that. There's measures for people in Centertown for mental health, because I'm sure that they're going to need it. It looks to me, if I may say, that mental health, and we were talking about substance abuse as well, is kind of a growth area in terms of public health. And I don't know if I'm speaking here, but maybe you could. I think that even if there's ways in the future, we're gonna see that as kind of collateral from what's taken place already. So just wanted your comments on that.
So specifically about the impact of the unlawful protests on people's mental health?
Yeah.
Yeah, I think, of course, people experienced it in different ways, you know, whether they were directly harassed, affected by the racism, the fumes and the noise. I think that most people will find they'll return to health as the environment's improved. So the getting back to the normal environment without the noise and the fumes, that will really be important and is helping people. Some will have ongoing anxiety or other challenges that may point to a need for more supports. And I think that, if people are having difficulty sleeping or they're having, concerns leaving the house, these are all indicators that people should reach out for more support. And so again, that's something we're trying to do with partners is make people aware there are supports. And we're hearing from the community on the ground, people's needs are different. Some people just need a bit of quiet, and we'll be okay to carry on.
Thank you. In terms of any possible variants in the future, is it? I take it that we've got sort of plans of action, because at some point, in terms of our new normal, we have to get back to our programming that public health was meant to do in the first place. How do you do that balance?
Well, this is the work we're undertaking with this roadmap, which does require some flexibility based on the kinds of demands that we'll see with different potential waves of COVID in the future. But we need to define, again, the community needs, the most effective services and programs that we can provide given our new context. And then we'll work to make those decisions about allocating resources to get back to more of these programs and services. So we're in the early days. We'll continue to provide updates as we're able to shift what we're focusing on.
And how is the province? Are they responding to this need for flexibility?
Yes, I think the province is starting to turn to the ideas of what recovery we need to do as a public health sector. Certainly, there's support for catching up on some of the work that we haven't done as much. So the catching up on childhood immunizations, for example, school-based immunizations. These are areas we know are being discussed.
Okay, thank you, and I appreciate your key messages. It's very helpful, and thanks to the whole team.
Thank you very much. Next up is we have 5 members left who could ask questions. We're approaching 7 o'clock. I'm wondering, Councillor Gauthier, if you could introduce the motion to extend past 7.
Absolutely, Chair. Let me find it. That be it resolved that the Board of Health approve that the meeting time be extended past 7 p.m. pursuant to subsection 8(1)(c) of the procedural bylaw.
Carried?
Carried.
Okay, thank you. Member Gower, please.
Thanks, Chair. I just want to emphasize how impressive Ottawa's vaccination numbers are. You mentioned it earlier, Dr. Etches, 88% of people older than 5 or older with 2 doses, 63% of adults with 3 doses. And on the dashboard today, it says for kids 5 to 11, at least 69% have over 1 dose. Those are incredible numbers. I also noticed in the vaccination dashboard that there's still an awful lot of people getting their first dose. And I was curious, is that mostly kids that we're seeing getting their first dose at this point? Or are we seeing still a significant number of teens and adults going for a first dose as well? Just looking for a bit of a breakdown on what we're seeing in those numbers.
I'm gonna call a friend on this one. So I know, yes, there are first doses among that 5 to 11-year-old population, which is, it's been slowly climbing up. Quickly got close to 60%, but more slow increase from 60 to 69. So friends being Marie-Claude Turcotte or Amira Ali, who leads our epidemiology team, of course. Marie-Claude, who's coming out for first doses?
So I think it's a mix of adults, children, teens. As people hear the message, they get the first dose. Of course, we also have our vaccine hubs in the neighborhoods where people can access. So if they haven't been able to access a vaccine, they can do that without an appointment in the vaccine hubs or in the main clinics. We can get you the exact numbers, but it's mostly a mix of different populations.
Yeah, it's encouraging because when you talked earlier, Dr. Etches, about the targeted approach, it's encouraging to see that that's actually being successful and encouraging people to get out and get first, second, or booster dose vaccination. So I'm glad to see that. I wanted to ask about schools. Can you give us an idea of since schools have gone back after the break for the holidays, what have we seen? Has COVID transmission mirrored what we're seeing in the community? Has there been anything that surprised you about what you've been able to observe in schools?
Yeah, it's not perfect anymore, our data sources. I guess it never was perfect of what's happening with COVID in schools, but we have a few ways we're looking at this. So the school absenteeism is the provincially supported method for schools to report in their absenteeism, and we look at the trends in absenteeism over time. It's been affected actually by weather in Ottawa, by snow days, by PD days, it appears. So the absenteeism is not the best on its own, although we look at it. And what we are taking a look at is what are the percentage of schools that require public health follow-up, because we're seeing a trend that's concerning. So that percentage of schools that's requiring follow-up is very stable. It's just stayed stable. The other thing we're looking at is of the children and youth in schools who can access the take-home kits, which again, it's not everybody who has symptoms that's using a take-home kit, but there are still some there and they're using them. What percentage of those turn positive? And it's been high, it's been 30%. So obviously a self-selected group, but it's been high. That's higher percent positivity than others who are eligible for testing, but it's been stable as well. So it's stayed about 30% over time. The other thing we're looking at, of course, is how is it looking with children getting respiratory illness that sends them to hospital? And so I noticed, member DiGiovanni here, but it looks like it's also been very stable. The number of children that are going to pediatric emergency departments, is about 200 every week. And of all the emergency departments, it's about 16% of emergency department visits. So that's also stable over time. It's been about 16% of visits are for respiratory illness. Of course, not all of that's COVID. And in terms of hospital admissions, that's actually come down. So we had more hospital admissions in January than we have seen in February. There's been quite a few weeks now where we've had nobody in hospital under age 20 for COVID. So that tells us actually there probably is less COVID among younger ages now than there was. So that's the kind of things we've been looking at. And I don't know if the team wants to add anything, but we're continuing to monitor the data sources we can. And so in terms of, is it the same as the rest of the community? I would say we're seeing a stabilization at a higher level of Omicron. So that's similar probably in the schools, stabilization at a higher level.
Okay, that's very interesting how the different signals you're monitoring. So thanks for that. You mentioned earlier, and Councillor Kavanagh was mentioning as well, the catching up on childhood immunization. One of the things that Dr. Moore mentioned last week at the symposium, the Alpha Symposium, was about encouraging health units to offer other vaccines beyond COVID at clinics. Are we doing that at our community clinics right now?
Again, it'd be wonderful to hear from Marie-Claude on this.
Okay.
Short answer, yes, but more details from Marie-Claude.
Yes, so we are also we are resuming the school vaccine. So Dr. Etch has mentioned that at the beginning. So we did cycle 1, and we're getting ready to do cycle 2 right after March break. So we're able to offer those vaccines to grade 7 and 8 and any other students who may have missed a dose. And we're also looking at restarting all vaccines in our clinics. So right now we're really focusing on COVID, but we are integrating other vaccines. So anyone who's any children who's missing any vaccines will be able to get an appointment in our clinic to be able to catch up. So we're reintroducing all the different vaccines one step at a time as we're having more capacity in our clinics.
That's good, because I know he also mentioned vaccines delivered through the COVID clinics, non-COVID vaccines, would also be eligible for COVID funding rather than the usual funding stream. So I guess there's a financial advantage to public health for taking advantage of the COVID clinics for other public health, which is good. I think that's all that I had. Yes, thank you very much, Dr. Etches and team, and thank you, Chair.
Thank you. Member El Shantiri.
Thank you, Mr. Chair, and thank you, Dr. Etches. Dr. Etches, a question came from the presenter about we didn't see or witness or the increase in cases. Do we have any information if cases will increase or non-increase, or will be hard to track it because the unlawful protests they were from different community, different area?
We wouldn't necessarily be able to attribute any increase in COVID during the time of the unlawful protests. We wouldn't be able to attribute it to people visiting the city. I think his estimate of the numbers that came in was probably a bit high. If people were using city facilities and infrastructure, then 91% of the wastewater, or 91% of our city systems go into the wastewater monitoring. So we would see potentially some change, and we really saw a very steady, slow decline over that period in the wastewater. So there's nothing that I can see that pointed to an increase, but it would be very hard for me to pick it out and tell. I'm not sure. I mean, many people came in for a weekend only. With a smaller number of people that were here for the 3 weeks. People who came in for the weekend only from many different places, they would, if they got sick, they may go somewhere else for treatment or testing. Not everyone's eligible for testing, though. Really, most of the population is not eligible for testing. So again, it wouldn't show up.
Okay, and the other question, and we hear it quite often. About the mental health and about, if you need help, call it. I mean, do we have the capacity if, we keep, we keep asking people to call and is that capacity available?
I think, again, it's not a million people in the city of Ottawa that need mental health counseling. Like a lot of people just need to get back to socializing and back to work and regular supports that will keep us well. When you start to see more challenge, that's when we would want people to know there are services available, and that the ways of accessing those services have become easier. So it may be there are some challenges with how much service is available once you go through that point of access, because we do see the demand has increased and the service delivery behind that point of access hasn't always grown. It's not grown to meet the needs. So I think it's fair to say there's not enough capacity yet to meet the needs of everyone who could benefit from some interventions. This is one of the things we want to show on our dashboard. We want to show the wait times that people have for the services that could benefit them. Which kind of services are we noticing the most gap in? People, adults calling in to get help through the Access Mental Health and Addictions line. The majority, not the majority, sorry, the largest group, 40% are calling with substance use health concerns. So that points to, okay, that's an area we probably need to bolster and invest in more substance use health supports. So I think using the data, providing that to partners, it's going to shape development of these services. And I know that's part of the conversation with government as well, is to help people understand there are people who need more supports once they connect in.
Okay, thank you, Mr. Chair. Thank you.
Thank you, Member El-Shantari. Vice Chair, please.
Thanks, Chair. Always commendations to public health and the public health team for all of the data and the good planning and forethought. I have no further questions tonight.
Thank you. And we move to Member Cloutier, please.
Thank you very much, Chair. Thank you, Dr. Etches, for the presentation. I missed some of the questions. I hope I'm not repeating any. First of all, thank you for your presentation, for acknowledging the loss, all the losses the community has had. I appreciated those words. And thank you, although regretfully, for the information about Ashley, who's done a wonderful job. Appreciate Jessica. So thank you to Ashley Brambles for the work she's done in the pandemic. One question with respect to the budget, you mentioned $84 million for 2021, but that there were some expenses at the end of 2021 that I think by your comments were not included in that $84 million. Will we be reimbursed for those, or is it simply a timing or a paperwork issue that we need to get reimbursed? Is the province still on track to make the city of Ottawa Public Health whole with respect to vaccination expenses and the additional expenses that generated by the pandemic?
That is my expectation of the most likely outcome here, for a couple of reasons. The province has to date supported pandemic expenditures. And we also let them know with our Q3, our third quarter reporting, we were projecting to need potentially $4 million more than we had budgeted to the year end. And that is just about where we ended up. So needing 4.5 million more to cover what happened with boosters and 5 to 11-year-olds and surge in people testing positive. So I do think they had some notice of what additional ask was coming, and we are just in the process of having submitted that actual expenditure to them, so that they can look at that and make their decisions about reimbursement. This is not dissimilar to last year, actually, where we had things ramp up in the fall, and we had spent $5 million extra compared to our budget in 2020, and the province covered that cost without concern, given it was a legitimate COVID response cost.
Okay, thank you for that. And I heard Councillor El-Shantari's question and your response with respect to, I think it was with respect to the occupation. Is the examination of the wastewater still a valid leading indicator? Are you still using it, that as a leading indicator with respect to the transmissibility, the propagation of the variants in our community?
Absolutely, yeah. We look at it every day. I think it's published, it's updated 5 times a week. And it is a useful indicator, as you said, early, not affected by testing. It's showing, nice decline from the peak in January, very slow decline now. And it is at a level that's higher than pre-Omicron. So it's not like we've had the Omicron peak and Omicron's done. It's still here. it's at a higher level than before the Omicron wave. So Omicron's continuing, and we know it's Omicron because they actually can test also for the type of COVID that's in the water as well.
Okay. Merci. Thank you.
Thank you. And finally, Member Banham.
Thank you. Thank you, Dr. Etches, for that fantastic, very thorough presentation. Really appreciated it. I might have missed this, but I'm wondering, this board passed a mandatory vaccine policy for ourselves and also Ottawa Public Health employees. And I'm wondering, with the changes, will Ottawa Public Health's own policy for mandatory vaccination be rescinded?
So like other employers, it is actually the City of Ottawa as our employer. So I'm a City of Ottawa employee. Everyone at OPH is a City of Ottawa employee. Employers are having to assess what they'll do with their own vaccine requirements. And my advice is, the goal we're trying to get to is people having their booster dose. So that third dose is really, what's important to promote still, and to make it easy for people to access the third dose. Because Omicron came along and the 2 doses is not stopping transmission of Omicron, it's still stopping hospitalizations and death. That 2-dose mandate isn't making the difference that it was making with Delta. So Omicron's changed that. We know what's important is that third dose, and so finding ways to help employers continue to make that accessible and promote that does decrease transmission 60%, and it does, again, even further protect people against hospitalization and death. So that's what we're focusing on. We're trying to let employers know, as I said, we'll still go out to workplaces where people are experiencing barriers to immunization. There's still value, but you see people are looking at the effectiveness of 2 doses differently. We want them to understand that third dose is still something to shoot for.
Thank you. And then, as we discussed, masking for children, turning it back to children under 5. So, I mean, everyone saw today, my child, who is under 5, likes to attend these meetings. She is like watching the pandemic grow. She was born April 3rd of 2020. But as we start to consider people coming together more often, it's very exciting that she might actually get a second birthday party, which is exciting. However, with the fact that they are still unable to get vaccinated, I know that factors into individual families' risk assessment, but are there going to be recommendations specifically targeted towards those families?
So we know overall children are less likely to be hospitalized and have severe illness. Among children, it's children under 1 who are more likely to be hospitalized. And then families will know if their child has an underlying health condition where they might want to take more caution. What we're trying to help people understand is if you're concerned about the risk to your child, keep choosing the lower risk activities. So keep getting together with people outdoors, keep the number of contacts relatively smaller. You can still use masks in indoor settings. So people are going to have to choose the things that they're comfortable with in terms of reducing risk if they're worried that someone in their household might have a more serious illness. And I think we know actually it's people over 80 who are most at risk. So if you want to think about, is that child visiting a grandparent, for example, in terms of how many contacts that child has, an opportunity to pick up COVID and pass it on. So I know this is a difficult transition, but again, others vaccinated around the child can help. Having that third dose when you're eligible, all those things can make a difference.
Wonderful. Just a couple more things. The Ottawa Birth and Wellness Center, which is my day job, was able to host 3 vaccine clinics specifically for pregnant individuals. And I just want to, you can hear Ari in the background. I just want to thank specifically Mary Claude and Andreas at Ottawa Public Health, who really made that happen. I get to see things from a certain level here on the board, but to see the operations and the team really work together on that kind of ground level was really wonderful, and they did a great job. So thank you for that support, and for the support that you don't offer just me, but all the other community clinics that receive the support and just the interest and enthusiasm from the staff. It's truly amazing to still see that enthusiasm 2 years into this. So thank you. And then of course, saying thank you to Ashley Brambles for all her work, and good luck in the future. And then the last thing I want to say is a bit to the chair as well, but I wanted to say thank you for the acknowledgement of the Ukraine invasion and conflict. As a Ukrainian Canadian, my mother is from that eastern border in Ukraine. But I also wanted us, as we have had our own statement about public health being a racism issue, as a Ukrainian Canadian, I do want to acknowledge that there are conflicts that go on around the world, and specifically in Ottawa, there are many specifically racialized communities who have conflicts that are ongoing in their communities. And I would just maybe ask, I don't know if it's appropriate for me to ask, that we also take a moment to reflect about those ongoing conflicts as an act of solidarity, not only with the people of Ukraine, but also those people who live through this for years. And I just thought that that would be a great way for us to kind of reflect and serve our community as a whole. So just asking if we could put that out there. And that's all. Thank you.
Yeah, no, I think that's perfectly appropriate, and why don't we do it right now? Yes, thank you. And Dr. Etches, I'd also like to thank you for your message and for taking all the various questions tonight. I appreciate your message. It's a message, as I see it, can be summed up in 2 words: caution and optimism, which don't seem like regular bedmates, so to speak. But I think you've made it clear to us that change is coming. That change is necessary. We need to get back together. We need to spend time with one another. We need to reconnect. But at the same time, to your clarification from the presenter we had earlier, we are not at an endemic stage. COVID is still out there, can still do damage, and so. But I think what you're saying to us is we need to get back to living the way we want to live, but we need to do that as cautiously and as safely as we can. So I think that was so nicely summed up in your answer to Member Banham's question about little kids and what does that mean, and bringing in the whole loop. In other words, bringing it up to the 80-year-old grandparent and saying, it's kind of a head to toe scan you have to do when you're deciding what sort of activities and who you're going to interact with and how that interaction is going to happen, and what level of risk you're willing to take. But as I say, still underlying that, it's time for us to start talking to each other, seeing each other, making those very important connections again for our mental health. So thank you so much for that. I think that's well stated and important for everyone to hear that that's the way forward, and also that public health will have supports, does have supports to help answer your questions about risk management and what support services are available to help a family or an individual through this. So again, collectively, I think it's something we can move forward with, and that the support that public health continues to provide is so important to getting us to that place of normalcy, if I can use that term anymore, but I want to use that term for sure. So can we receive this report then? Thank you. I'm going to then ask Member Cloutier to move the motion to adopt reports.
Certainly, Chair. Motion to adopt reports. Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, and the reports titled Delegation of Authority, Contracts Awarded for the period of January 1st to June 30th, 2021, and attendance at the Association of Local Public Health Agencies Alpha Board of Health section meeting be received and adopted.
Carried?
Carried.
Okay. I don't believe that there are any motions requiring suspension of the rules. Are there any motions, however, for consideration at a subsequent meeting? Okay, seeing none. Councillor Cloutier, could you please move the confirmation bylaw?
Certainly, Chair. Il est résolu que le règlement de ratification numéro 2022-2, un règlement municipal du Conseil de santé de la circonscription sanitaire de la Ville d'Ottawa ratifiant les délibérations du Conseil de santé d'Ottawa lors de sa réunion du 28 février 2022 soit lu et adopté.
Okay. Carried. Does anyone have an inquiry? Okay, again, seeing none, will adjourn the meeting. There are a number of things that I need to read out before then we close, though. I just want to remind any media who may be watching this meeting on YouTube live stream that we will have a Zoom media availability 15 minutes after adjournment. This replaces the post-meeting media scrum that would normally happen after in-person meetings. If not already registered, media representatives wanting to participate can email ophmedia@ottawa.ca. Thank you, everyone. Our next regular scheduled meeting is April the 25th.
Thank you.
Thank you all.
Bye, everyone.
Thank you.
Thanks all. Take care.
Bye-bye.
Good evening, bonsoir, je m'appelle Maxime Lé et je serai votre modérateur aujourd'hui. My name is Maxime Lé and I will be your moderator today. Thank you for joining us for today's media availability following the second Board of Health meeting this year. Merci d'être parmi nous à la suite de la deuxième réunion du Conseil de santé cette année. Before we begin, a few reminders. Please place your microphone on mute until I invite you to ask your question. Veuillez désactiver votre microphone jusqu'au moment de poser votre question. To view who is speaking on Zoom, please put your view on speaker view instead of gallery view. The button for this is located in the top right corner of the Zoom video screen. Veuillez changer votre écran en mode speaker, en anglais, pour pouvoir mieux voir les porte-paroles. Ce bouton est situé en haut à la droite de votre écran. On the call this evening, we have Board of Health Chair, Councillor Keith Egli, and Medical Officer of Health at Ottawa Public Health, Dr. Vera Etches. Ici, durant cette soirée pour vous, nous avons le président du Conseil de santé, le conseiller Keith Egli, et la médecin-chef en santé publique à Santé publique Ottawa, Dr. Vera Etches. I'll now invite each media agency, in alphabetical order by outlet, to ask their questions. Please remember that you have one question and one follow-up. Nous allons maintenant répondre aux questions des médias en ordre alphabétique selon l'agence et chacun pourra poser une question ainsi qu'une question de suivi. I will now begin with CBC Ottawa, Guy Quenville. Guy, over to you.
Good evening. Can you hear me okay?
All good.
I hope, Doctor, you had a chance to hydrate and have something to eat during that break. It's a lot of talking for you. My first question is about one of the statements you made at the outset, recognizing that tomorrow some of the provincial public health measures will lift, including the vaccine passport requirement and all remaining indoor capacity limits. I think you said in regards to that we, OPH, are not planning locally to recommend further public health measures as provincial restrictions are lifted. So I just want to maybe clarify or refresh my own memory. As we see those provincial rules lifted tomorrow, will there remain any Ottawa-specific public health measures that you want to underscore or perhaps remind us of, or will there not be any such local specific rules remaining in place? Just sort of paint the landscape for us once those provincial ones go away tomorrow.
You're correct, Guy. Once the provincial requirements related to physical distancing, capacity limits, proof of vaccination, once these are removed tomorrow, there is no further local considerations or requirements that are in place. And yet, I guess we do want to recognize there are some measures that are still going to be useful, right? So vaccination remains very useful, and especially adding that third dose. Mask wearing is still required by the province, and it is still useful. We do want to assess the impact of this reopening before we, let go of mask use, and also before we're really comfortable saying that people don't need to proceed cautiously. Like we're still saying, I'm still saying, in Ottawa, Omicron is present in our community. We still want to go forward with some caution based on the risk to members in our close circle for more serious illness. So we're asking people to be vaccinated, to do that risk assessment, and then choose the lower risk activities if you're concerned about someone more vulnerable. Lower risk being the same as we've always been learning and practicing over the last 2 years: outdoors, smaller numbers, not a crowd, avoid indoors without a mask. Those kinds of things are still very useful.
Thank you. And you walked us through some of the local indicators that have thankfully decreased recently, but pointed out a couple that have merely plateaued, meaning they haven't decreased. And I guess in that context, I mean, we know that there's probably going to be an announcement, or we expect something from the province perhaps soon about masking, perhaps not. But I'm wondering if you can give us some sense, given Ottawa's particular situation right now and the indicators you mentioned, like if the province were to come to us, say, in the next week and say that they're going to lift the masking requirements a week after that, so 2 weeks from now, would that be too soon in your mind for Ottawa, given our situation, or would that be okay?
I would like to see, 3 weeks of assessing the impact of the reopening, because it does take a couple of weeks to see whether there's been more transmission, a growth in transmission. And even, it takes a little bit longer these days because we're looking for it to show up in hospitalizations, which are usually a week behind when the transmission occurs. So really, we would have a better assessment of how well we're managing to keep Omicron under control after 3 weeks. It's step by step is really the safest way to go here. It's a big transition already in terms of no capacity limits in any place. I think we need to help people take one step at a time. This is uncomfortable for many. Some are at higher risk for severe illness. I mentioned there are 25,000 people over age 60 who don't have a booster dose. And, each of those people is at higher risk for severe illness and would benefit from having a booster. So if we can use this time to continue to remind people we're moving into more opportunity for transmission as more things open, this is still a time you want to turn to as much protection from vaccination as you can.
Thank you very much. Thank you, Guy. Next up, we go to CTV Ottawa, Ted Raymond. Ted, over to you.
Hi, thank you. Hopefully you can hear me okay.
All good.
Excellent. Okay. So my question is for Dr. Etches as well. Just kind of jumping off of that previous point with regards to masks, possibly the mandate ending within the month, based on some of the suggestions from the Premier. But we know there are some voices that are also calling to keep them in place, especially in schools, for a bit longer. If a mask mandate province-wide comes down and they say no more masks anywhere are required, are you prepared, or are you able, even at this point, to do a kind of a local mandate should it be required in schools or locally, or to recommend to council to bring back maybe the temporary mask bylaw? Is that something that you're considering?
So I'm not considering local measures at this point, given we're following the downward trend and we're similar to the rest of the province, although the north actually is in some parts having higher rates. And in fact, local medical officers of health are no longer able to use the Reopening Ontario Act to issue letters of instruction. So I think it would be a conversation with our chief medical officer of health. If I was starting to see things turn around and not just turn around, because we might expect some increase in COVID. It's really more, are we getting those severe outcomes? I'll talk to our hospital partners. Are our hospitals starting to have trouble coping again? Like that would be something where I would be speaking with our chief medical officer of health to say, we need to look at what else we can do to decrease transmission in Ottawa at this time. So I think you're right. It's sort of a let's monitor and have those conversations if we need them.
Okay. And my follow-up question also is to you, Dr. Etches, with hospitalizations obviously coming down. The demand for testing, that crush that we saw in early January that forced the province to kind of put things on hold and restrict it. Do you know if there are any plans, or are you recommending to the province, if you have any conversations about bringing back or reopening PCR testing at our local assessment centers to the general public?
So it was a provincial decision. It is a provincial decision about who's eligible for PCR testing. And I'm not aware of any plans to change who's eligible. I do recognize the challenge with testing is not an intervention that can really stop or slow down the transmission of Omicron. It happens so quickly with the short incubation period and the high degree of transmissibility. So that test result usually comes after there's been transmission, and it also doesn't change the management in many situations. So I think what I hope could be clearer about testing, I don't know that everyone understands this, is that if you may be eligible for a treatment, then you need to access the COVID PCR testing within 2 days of symptom onset. And it's a bit hard because not everyone thinks they're eligible for COVID testing, but some are eligible for treatment, especially if you are not vaccinated. Then you can access treatment through assessment center that's offering that service, and you need to have the PCR testing, so it's offered to people who are candidates for COVID treatment. So I think this is something we'll need to look at how to make clearer for the population that would be access to testing that it could grow.
Okay, thank you very much. Thank you, Ted. Nous allons maintenant passer à Radio-Canada avec Emmanuel Poisson. Emmanuel, c'est à vous.
Merci beaucoup. Bonjour, Dr. Etches. Ma première question pour vous, c'est, demain, on sait qu'il y aura la levée du passeport vaccinal en Ontario, de la preuve vaccinale en Ontario. Pourriez-vous le dire en français et en anglais? Vous, personnellement, trouvez-vous que c'est une bonne façon d'avancer dans la pandémie? Est-ce que vous auriez préféré, est-ce que Santé publique Ottawa aurait préféré maintenir la preuve vaccinale plus longtemps dans certains lieux publics? Comment vous vous sentez avec cette levée de la preuve vaccinale?
C'est vraiment intéressant avec le change dans le variant entre Delta et maintenant Omicron. Avec Delta, les 2 doses ont fourni une bonne protection contre la transmission de la virus, mais avec Omicron, les 2 doses ne fonctionnent pas le même, ils ne sont pas efficaces pour réduire la transmission. Alors, c'est pourquoi on regarde la preuve de vaccination différemment. Pour moi, le point important, c'est la promotion de la 3e dose. Parce qu'avec une 3e dose, ça peut diminuer la transmission et aussi augmenter la protection contre les infections sévères. Alors, pour moi, je voudrais travailler avec les employeurs et les autres partenaires pour promouvoir la 3e dose. Et c'est quelque chose qu'on continue d'offrir à Santé publique avec nos cliniques dans les quartiers. Aussi, il y a des options mobiles d'aller dans les lieux de travail s'il y a des barrières. Ça, c'est l'approche maintenant.
Merci beaucoup. Ma deuxième question, vous avez dit un peu plus tôt que Santé publique Ottawa ne prévoit plus recommander d'autres mesures de santé publique à l'échelle locale au fur et à mesure que les restrictions sont levées à l'échelle provinciale. Pourquoi adopter cette approche-ci et ne pas conserver une approche plus locale comme on le faisait?
Parce que la tendance est bonne. La quantité de COVID-19 a diminué Et on a une situation tellement similaire que les autres parties de la province, sauf que le nord, il y a un peu plus de COVID au nord, dans certains quartiers maintenant. Alors, c'est important de décrire qu'il y a une différence à Ottawa, un risque plus haut d'avoir les mesures locales et locales. Alors, si on va un changement mauvais où les hôpitaux sont stressés encore, c'est quelque chose, je vais discuter avec notre chef en santé publique pour la province, Dr. Moore, de créer des approches de ralentir la transmission de COVID-19 dans notre ville.
Merci beaucoup, Emmanuel. Merci beaucoup, Dr. Etches. Donc, c'est tout le temps dont nous disposons aujourd'hui. Merci d'avoir été présent et à la prochaine. That is all the time we have for today. Thank you for tuning in and see you next time.